It's time for our nonprofit news brought to us by RVR Bank. Today we have Three Rivers Public Health coming in and taking a little bit of time. Thank you for coming in today, be able to talk to us.
Thank you. We appreciate
And
being here.
so, again, Three Rivers Public Health covering Dodge, Saunders, and Washington counties. A lot of things going on around us. You guys it is summertime. You guys are busy.
Yes.
And again, there's some festivals out there. I know some car seat checks coming up around the area. We'll get that stuff posted. But you wanted to kind of talk about some of the things that you have available still, and be able to kind of keep in mind what people can get or be a part of right here in our area.
Absolutely. Thank you. So, of course, we're still offering the radon kits and the rural well water kits. We offer those at our 3 locations. Also, we've got school starting. I mean, it's coming quick. We're in the summer months, but school will be here before we know it. So,
yeah, we're halfway through the summer season already.
Yes, already. It's moving quickly. Just so folks are kind of aware, or just to be ready for the kids and their vaccinations that they need. We can certainly do vaccinations here in Blair and Fremont and Wahoo. So just to reach out so we can make sure we do have the vaccine there here in Blair, especially for those that would want to get that vaccine for either adults or the kids. Also want to talk about the summer months. Of course, it's hot. We've been having the heat to be watching out for heat exhaustion, heat stroke.
Stay hydrated and things like that.
Absolutely.
Yeah.
Seeing a few folks that are, a lot of yard work going on, a lot of outside activities. So just to make sure you're, as you said, staying hydrated, drinking a lot of water, and taking care of ourselves to make sure that we stay healthy.
And we've had a little different summer so far with some of the rain, so it's a little more humid, So it kind of feels like it's hotter, but when it was dry, then you don't realize how hot it is. So no matter what, the heat is impacting people pretty quickly.
It is, and those folks that maybe don't have the air conditioning or have the availability, we just need to be watching out for our neighbors.
That's right, especially elderly.
Absolutely.
Yeah, because that's actually one of the biggest situations that happens. They don't, the older you get, I notice this. Sometimes the colder I get, sometimes so. And then you don't realize when the heat does hit you. Absolutely.
I'm right there with you. So yeah, as we get older, things change, don't they?
They do.
Also wanted to kind of talk about briefly, of course, mosquitoes.
Yes.
With the humidity, we have had the first case, not here in our counties, but here in Nebraska, we've had our first case of West Nile virus, human West Nile virus case in 2025. Just to make everybody aware that mosquitoes are not, they in a lot of locations, but they're not tested in every location.
Right.
So we just need to be on the lookout for that if we're outdoors, if we're in the woods or in those kind of areas, that we need to wear the proper protection and be watching out for that. Also, even though it's hot out, we're going to be out in those areas. We want to wear long sleeve shirts and long pants, as tough as it is, as hot as it is, but we want to protect ourselves with that.
Well, we've had a lot of rain. That creates a lot of pooling, which is prime for mosquitoes to be able to reproduce.
Absolutely.
And so I know in the past you've had some dips or stuff like that.
We have the dunk still.
Yeah, still have the dunk to be able to help prevent the mosquitoes as much as possible. But there's still going to be a lot out there. You guys have done a lot of trapping and send them out, so you're just waiting for results in our area?
Yep, we have done certainly the trapping that we do every year, and just waiting on those results. And of course, if we have anything that comes up, we will certainly be sharing that with the public
and
to let everybody know.
Again, follow on Facebook, website, and everything like that, because as soon as you put it out there.
Absolutely. And of course, we've got the county fairs coming up. End of July, first part of August in the 3 counties. So we're going to be present there. We're going to have a lot of information on our programs, on the things that we can offer. And so if they're able to stop by, we're kind of narrowing down the dates and the times right now, but we will be putting that out very quickly. But we'll look forward to seeing everybody and be able to talk to folks about what we have to offer at the health department.
Normally, the 3 county fairs are like spread out a little bit more. This year, that's kind of consolidated. So you have to kind of multiply yourself to be able to be every place at the same time.
Yeah, it's a challenge, but we're up for it. So And we look forward for everybody to see us.
So again, threeriverspublichealth.org is the website you can be able to go, or just look up Three Rivers Public Health on Facebook, social media, or anything like that, and be well aware of what is happening. But like you said, we're halfway through summertime, looking forward to school here and vaccinations, and make sure everybody is up to date on what they need.
Absolutely.
But again, if nothing else, a resource to learn about them.
Yep, absolutely. We certainly can provide those resources.
All right. Well, again, thank you for coming in, and you're going to be hanging out in Blair for a while.
Yep, I'll be here for the day.
All right. So
look forward to seeing anybody that wants to come in.
Yeah, and that office is open Monday through Thursday.
Correct. And then off on Fridays there.
Or by appointment only on some days.
Yeah, I mean, the health department people certainly can walk in.
Yeah.
Clinic, you can certainly walk in, and if we're able to help with vaccines or whatever that may take, we're certainly available. So,
all right. Well, thank you for coming in and telling us what's going on right now in our area.
Thanks so much. Thanks for having us.